Hello everyone, this is just a quick video with regards to your learning plan that is due very soon. I'm going to show you kind of how to best utilize the resources that are available for you and to do that learning plan. And remember that your draft learning plan has to be submitted to eClass. I will provide you feedback, and that feedback could be an improvement and you're going to have to resubmit it, or it is satisfactory and that you can do your first learning plan and it'll be your final learning plan as well, so depending on the feedback received. But first of all, I have shared with you a Google Drive. This is where you have your monthly schedule that you have to update. There's also email etiquette tip sheet, so how to write professional emails. But right here, simple learning plan, okay, for 4527. So click on that, open it up, and this is what it looks like. All right, so let's have a look at each column and what is required. So the first column is individual team learning goals. Also identify course outcomes. Are you working towards this goal? So this person right here, the example is for goal number 1, to be able effectively interpret arterial blood gases, ABGs, results, and make connections between the ABG results and the client's overall health status. Okay, so it's very specific, it is attainable, it is something that you're going to be able to do in the clinical setting. All right, so the next column, it says activities to achieve this goal. So what will you do? How will you achieve this goal? These activities should link to the indicators of the course objective. So also over here, you'll see the course objective is number 3. So for this particular goal, you have collect laboratory results, ABGs, from 3 different clients, okay, from electronic medical records. Perform literature search on ABGs interpretation, find at least 1 relevant article, and review my class notes on ABG interpretation, and work collaboratively with the client clinical staff such as preceptor, CCD, staff, nurses as the last activity. So the resources and support, so how are you going to meet that goal? This has to be specific. Indicating that I'm going to use my books is not enough. You actually have to indicate in the APA 7th edition formatting what that looks like. So what books you're going to indicate. So this person indicated medical surgical books that they've used during their learning in the program. Next one is the Potter Perry as well. Okay, and because they indicated here 1 relevant article, there it is. The relevant article is indicated here as well in the APA 7th edition formatting. So indicating, saying search for articles or search online is not sufficient. You have to be very specific. What are you going to be reviewing to meet the learning goal? Okay, so meet this learning goal. And then let's look at the evaluation criteria right here. So be specific. It is so important to be the specific in here. A majority of these things that are listed here will be included in your portfolio. Okay, so let's look at this. Interpret 3 ABG's results and submit them into my portfolio. Perfect. So the evidence will be included in the portfolio. I will be able to look at that portfolio and say, yes, this goal has been met, because I can see the results and the submission into that portfolio. Next is complete 1-page write-up as result connecting with ABG's results of the client's health. So looking at those clients' health, right? Looking at the, right here, remember it said 3 different clients, electronic medical records. So interpreting those, understanding those, and writing 1-page write-up that will be also included in the portfolio. And the other evidence is creating and developing a concept map with regards to this particular goal, and will be included in the portfolio as well. Okay, so in here, if you just say, increasing my knowledge with regards to ABGs, Okay, how will you prove that you have increased it? You have to be very specific, and it has to indicate how I, as your CCD, be able to evaluate you that you have been effective in learning what ABGs are instead of just increasing your knowledge. Okay, and then, the other things sometimes I see is students say, I will educate my patient. I am not there to evaluate your education piece, but yes, your preceptors are. So maybe writing something like, my preceptor will evaluate my knowledge and my education to my patient, and he or she will write this evidence in my midterm evaluation or final evaluation on how I did on educating my patients. So that could be an evidence as well that it will be indicated in your evaluation. Okay? Let's look at the second one quickly here. So this one is to develop a better understanding of the role substance abuse players on adolescents' mental health and assess best practice guidelines and institutional policies. So we have a couple different things here, right? We have a specific substance abuse. We have a specific population, adolescents' mental health. We have best practice guidelines and institutional policies as well. So activities, conduct a literature search, okay, read at least one peer-reviewed journal article, seek my preceptors and CCD staff and physicians about their experience in particular patient population. So they're doing a little bit of an interviews from the preceptor. Once again, I'm not going to be there, but your preceptor and the staff nurses and physicians are going to be there, so you can do that. Assess current institutional policies, so relating it exactly what it specifically says in here, and best practice guidelines, RNAO. So articles, institutional policies, best practice guidelines, very clear, very specific. And how this will be accomplished is this person will create a poster board to staff outlining best practice guidelines, institutional policies, resources to staff and patients on substance abuse, adolescents' mental health. A picture of this board will be submitted as an evidence of personal portfolio. So they're going to create something for the staff, post it up in that, whatever it might be, their staff room, their hallway, so that everybody can see. And the student will take a picture of that of creation of the board, and will be submitted as evidence into the portfolio. Okay, and then they go on to being even more specific. So they are posting this board as a display for the staff lounge with a common question box, and feedback will be submitted as evidence in the portfolio. So they're seeking some feedback from the poster board that was created, and that feedback will be submitted in the portfolio. Okay, so hopefully this will help you kind of organize your goals and be very specific what is required. And just this last column is the due dates. So you set your target dates or due dates whenever you like. Don't leave everything to the last minute. One or two of these should be completed before midterm, and the rest should be completed at final. Okay, hopefully this helps, and let me know if you have any questions. Thank you.